very good afternoon, everyone. I am Dr. Vivek Agarwal. I am the consultant neurointerventionist at Fortis Hospital Mohali. I talk about the signs of stroke. How will you identify stroke among yourself, your relatives, and friends? So, to identify the stroke, there's an acronym that goes in the name of B FAST. That means BEFAST. B stands for balance. Sudden loss of balance can be a sign of stroke. E stands for eyes. Sudden loss of vision can show that the patient is having a stroke. F stands for the facial deviation. When you see that the face is moved toward one side and there's a drooling of saliva, that means the patient is having a stroke. A stands for arm or leg weakness. Inability to elevate the arm or leg against the gravity shows that the patient is having a stroke. S stands for the speech. Slurring of speech and any abnormality in the speech could be a sign of the stroke. And T stands for time. Remember, time is brain and reach the hospital on time. I'll be talking about prevention in stroke. Stroke is an emergency thing, so to prevent it, you have to change your lifestyle, you have to follow certain dietary habits and reduce the stress to prevent the stroke. So going with the elaborating it, I would say number one point to prevent the stroke is the control of your sugar levels. Prevention of diabetes, take your medicines regularly, visit your endocrinologist, eat healthy food. These are the three measures to control your diabetes and to prevent the stroke. Second comes the blood pressure. You have to lower your blood pressure to the optimal levels. Consult your doctor, take your medicines properly, avoid stress, decrease in the salt intake. Don't stop salt, but you can always decrease the salt to prevent the stroke. Third comes your eating habits and your lifestyle. The more fat you take, the more cholesterol-rich food you take, the more you are at the risk of having a stroke. So you decrease the intake of the fat to the optimum level so that you take the good fat, increase the HDL levels and decrease the LDL levels to prevent the stroke. Avoid stress, do regular exercises, go to gym, do resistance training, take the protein-rich diet. All this will help you prevent the stroke. Avoid junk food. Okay, don't order just to sit at home, and ordering the junk food always causes the stroke. Exercise is very important. Decrease the weight to prevent the stroke in that. I'll be talking about the role of radiologist in managing the stroke patients. So role of radiology, it starts from the ER in the form of the diagnosis of the stroke as well as the treatment of the stroke in the cath lab. So at Fortis Mohali, we have all the modalities available 24/7, be it CT scan, CT angiography, CT perfusion, as well as the MRI brain and MR angiography. So for the stroke patient, we take the patient from the emergency room to the radiology room. We do the CT scan or MRI. We go for the imaging in the form of the angiography, diagnose the stroke, and then we go for the treatment. So the treatment of mechanical thrombectomy by a radiologist is the mechanical thrombectomy. Mechanical thrombectomy means removal of the clot. How we do it is, we take the patient to our biplane cath lab and then we take the patient anesthesia care or a general anesthesia. We insert a small pipe that goes in the groin area or in the arm. We reach the brain, we deploy a stent or a catheter and we aspirate or take the stent and remove the clot from the brain. Believe me, it is not an open surgery, it is just a pinhole approach through which we go from groin or hand to the brain and remove the clot within few minutes. And patient improves on table. The process is mechanical thrombectomy that can be done up to 24 hours but should be done as soon as possible.